Raja Gajanana Gavaho Lambodara Guru Ati Sukadata Lambodara Guru Ati Sukadata Antar Bahir Gavaho Antar Bahir Gavaho Ganaraja Gajanana Gavaho Ganaraja Gajanana Gavaho Adinarayana Nishadina Smaratam Adinarayana Nishadina Smaratam Tanmaya ho Nigavaho Tanmaya ho Nigavaho Ganaraja Gajanana Gavaho Ganaraja Gajanana Gavaho. Thank you.
Thank you, Dr. Shweta. It was so divine. Now I request Dr. Gopalakrishna sir, Secretary of TRIBHUVAN Holistic Health Foundation, to give the welcome address and also the introductory note on TRIBHUVAN Holistic Health Foundation. Over to you, sir.
Hari Om Namaste. It's a great pleasure to be a part of TRIBHUVAN Holistic Health Foundation. I'm being the secretary. Have the privilege of welcoming you all to this 20th session of Vaidya Sammilana. At the outset, I welcome Dr. K.S. Jayashree, the motherly character in our TRIBHUVAN Holistic Health Foundation, who is the key strength in every aspect, leading every one of us, guiding every one of us. I welcome you, madam. It's also a great pleasure to welcome Dr. Shaila ma'am, whom I know past 3.5 decades, developed her academics as well as the strength in the science wonderfully. I welcome you, madam, also. And it's a great pleasure to welcome everyone who is participating today's online Vaidya Sammilana. TRIBHUVAN Holistic Health Foundation, which was founded by Dr. B.S. Nataraj and Dr. K.S. Jayashree 3 decades ago, has developed bounds and leaps. It is identifying the silent servers of the society, honoring them, and training all the practitioners, which is necessary to update ourselves in the field of Ayurveda practice, understanding the siddhantas of the science, samhitas, and dravya vivechana, and Vaidya Sammilana, Tadvidya Sambhasha, and hands-on meeting and hands-on training in workshops and medical camps, identifying the meritorious students, honoring them, and also honoring who stood first in the university in the RJHS. A gold medal is also given in the name of Dr. Nataraj sir. We are serving past 3 decades with the help of you all people. You are all the backbone of the TRIBHUVAN Holistic Health Foundation. Recently, we have also started our website. And now the Vaidya Sammilana is also available on YouTube Live. One who cannot join on this Google Meet, directly they can join through the YouTube Live. We all need your support by participating and updating ourselves and serving the society. The motto of the TRIBHUVAN Holistic Health Foundation is to update, learn the science, and practice the science scientifically. I welcome you all. Thank you.
Thank you, sir. Now I request Dr. Madhavi Lata ma'am to introduce today's resource person, an eminent personality, a renowned Ayurveda physician, an academician, an educator, and motherly affectionate Dr. Shailaja ma'am, Principal SDM College of Hassan.
Yes,
Over
Vaidya.
to you, ma'am.
Yeah. Respected dignitaries and dear friends, it is my great honor and privilege to introduce an extraordinary personality in the field of Ayurveda, Dr. Shailaja U, a distinguished scholar, compassionate physician, visionary academic leader, and an inspiring mentor. Dr. Shailaja is currently serving as the Principal Medical Director, Chief Medical Officer, and Professor at Sri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital, Hassan. With nearly 3 decades of dedicated clinical, academic, and research experience, she has made remarkable contribution to the advancement of Kaumarabhritya. She completed her BAMS from Karnataka University, her MD in Kaumarabhritya from Rajiv Gandhi University of Health Sciences, and earned her PhD from Rajasthan Ayurveda University. Her doctoral research focused on Ayurvedic management of cerebral palsy, reflecting her deep commitment to improving the quality of life for children with neurological disorders. Dr. Shailaja is an approved guide for postgraduate and PhD studies and has successfully guided more than 70 postgraduate scholars with several doctoral research projects currently under her mentorship. She has published over 130 research articles in national and international peer-reviewed journals and has led multiple research projects as principal investigator. Her areas of expertise includes cerebral palsy, autism, ADHD, bronchial asthma, seizure disorders, child nutrition, and preventive pediatrics. Through her integrative and evidence-based Ayurvedic approach, she has brought hope and healing to countless families. Her excellence has been recognized with several prestigious awards, including Kashyapa Ratna Award, Fellowship of Rashtriya Ayurveda Vidyapit, Doctor of the Year 2025, and Ayurveda Vishwaratna. She has been a keynote speaker and resource person in more than 100 national and international seminars and has represented Ayurveda globally through visits to countries such as Japan, England, Switzerland, and Malaysia. Beyond her academic brilliance, Dr. Shailaja ma'am is deeply committed to community health awareness through television programs, radio talks, and public health initiatives. Dr. Shailaja madam truly embodies the spirit of Ayurveda, combining knowledge, research, service, and compassion. With great respect, I request Dr. Shailaja madam to kindly deliver her valuable talk. Thank you.
Namaste to all. Namaste to Jayashree Madam and all members of TRIBHUVAN Health Foundation. So I am very happy that I am part of TRIBHUVAN Health Foundation by presenting my views on healthcare of a pediatric age group. And by this presentation, I'm also getting misconnection with my old friends also. Gopi Krishna, Gopal Krishna, and many more. So is it visible, PPT? Am I audible?
ಮೇಡಮ್ PPT ಬರ್ತಾ ಇಲ್ಲ.
Okay.
I'll share from my end.
ಅಲ್ಲ 1 minute.
ಹಾ ಮೇಡಮ್
Banta.
Now it is visible.
Okay.
You can make it full screen now.
Okay. Ida. Full screen ಆಯ್ತಾ?
ಇಲ್ಲ ma'am.
ಇಲ್ಲ, ಒಂದು ನಿಮಿಷ. ಫುಲ್ ಸ್ಕ್ರೀನ್ ಆಗ್ತಾ ಇಲ್ಲ.
ಮ್ಯಾಮ್ ನಾನು ಶೇರ್ ಮಾಡ್ತೀನಿ.
ಹೌದಾ? ಓಕೆ. So as we all know, pediatric health is very much important. Today's children are tomorrow's citizens. If we take care of children of today, they will take care of the country of tomorrow. So that is why maintenance of their wellness, and if they had any illness, managing them is very much important. This view. So here my presentation, management of wellness and illness in Kaumarabhritya clinic. So next slide. So as we all know that many times people think that we practice anything can be practiced in children also, only with the less medicines, means less amount of medicine, and with the maybe minimum quantity, and also by the medicine which is with the soft nature, mradu guna. But it is not like that. So management of diseases in children differs from management of diseases in adults. Why? Because children are with the certain special qualities. Tatra balam aparipakva dhatuhu ajata vyanjanam sukumaram aklesha saham asampurna balam shleshma dhatu praya ashadasha varshat. Children are sukumara, very tender. They are with alpakaya. They are delicate and they are small. And they are not taking all the food also. Sarvanna anupasevanat. So their likes and dislikes are different than the adults. And certain food only they like. For example, they may like, nowadays children, they may like more chocolates, biscuits, bakery items, etc. And what is actually required, they may not be taking. So sarvanna anupasevanat aparipakva dhatu. Their tissue and all, so not yet completely developed, and they are with asampurna bala. Their immune system is yet to develop. They are not yet, means immune system is not completely developed. And Shleshma Dhatu Praya is known to all, Anavastita Sattva. So their Sattva is also not completely developed. So we know that if the willpower is strong, if the Sattva is strong, any diseases can be taken care. Whereas in children, their Sattva is Anavastita. That is why the diseases like autism or ADHD, etc., that will be mainly observed in children only. And Vak Cheshtayor Asamarthya, very younger children, they are not able to, means infants and all, smaller infants, they are yet to develop their development, and speech also is developed later, and their expression, whatever they want to express, may not be able to express it properly. So these all qualities of children, mainly that means we have to respect to these all things, and while management of their disease, we have to take care of these all things. Next slide, please. So let us discuss about this wellness in children, because we know that swastasya swastya rakshanam, aturasya vikaropashamanam. That is the aim of Ayurveda. Similarly, the aim of Kaumarabhritya is also same. Kaumarabhrityam nama Kumarabharanam. Swastasya swastya rakshanam is represented in Kaumarabhritya as Kaumarabhrityam nama Kumarabharanam. And aturasya vikaropashamanam is the rest of the definition of Kaumarabhritya is aturasya vikara prashamanam. So how we can take care of the wellness or swasthya of children? So we have with us samskaras, starting from the conception, garbhadana samskara, up to antyeshti we have samskaras, but many of these samskaras, shodasha samskaras, are undertaken during the pediatric age group only. So starting from the conception means it is not after the birth of the baby, at the starting point of the life, that is at the time of conception itself, that is garbhadana samskara, and then pumsavana samskara, simantonnayana samskara. These all samskaras helps a lot to have good progeny and their health, and also to have better prakriti and also better immune system. And after birth, we have many samskaras during the pediatric age group. So for example, and that will be discussed next slide, and dinacharya, rutucharya, rasayana, these all are also very much important in taking care of the wellness of children. Achar rasayana, sadvrata, these all things, if they are adopted during the pediatric age group itself, their wellness is taken care and they will be becoming best adults tomorrow or future. So that is why these all things need to be taken care. Next slide, please. So when we discuss about these samskaras, as I told, so all pediatric samskaras are very much important for the growth and development of the children. In them, Swarna Prashana, which comes under the Jata Karma. So in Jata Karma, which is done immediately after the birth. So there, we get the reference from Sushruta, mainly this Swarna Prashana we get, and in Charaka what we are getting is Madhugrata Prashana for Jata Karma. In Graha Sutra and Manusmriti, we have the reference of Swarna Prashana to the baby. And why this Swarna Prashana is indicated in Jata Karma, that is for purpose of the proper growth and development of the baby, and also Garbhambu means because of the Garbhambu Janita Vyadhi Nirbharanartham. So whatever the diseases which occurs because of the Garbhambu, means not only Garbhambu, whatever the teratogenicity or teratogenic effect which had during the pregnancy period, to overcome those all, Swarna Prashana is done. So that is discussed under the Sankalpa of Jata Karma Samskara itself. And we know that Swarna Prashana is giving lot of strength to the babies. Masad Parama Medavi, Shadbir Masad Shratadaraha, Varshavaram, Vapur Lida, Ayushyam, Mangalam. These are all different Palashrutis for the Swarna Prashana. And this Swarna Prashana, so in our institution since 2009, so on Pushya Nakshatra, we conduct since 2009, May 27th, till date. Every time, it may be more than 11 lakhs administration of doses of Swarna Prashana had up to now. And every time, more than 5,000 children of Hassan and around, they are receiving Pushya Nakshatra Swarna Prashana. And we are also giving daily Swarna Prashana in the name of Kaumarabhritya. So Kaumarabhritya Prashana is also given the baby one who delivered in our hospital, and in and around the Hassan city, the children who are born in other hospital also they come for care from our hospital with the intention of receiving this Kaumarabhritya Prashana. So this Swarna Prashana Leha or Kaumarabhritya Prashana Leha, daily it is given to the children up to 1 year, and many parents of them, they are continuing even after 1 year also. Next slide, please. So another procedure which is helping for the health of the infants and also to make the infant with all immunity and also good strength of Agni is Suttukara or Suttumaddu, which is practiced and also called as Uramarannu in Kerala. So actually this Uramarannu or Suttumaddu, what is given is mainly for improving the or proper that takes care of the Agni of the baby, and also that helps lot to not to have diseases during the infant period and to improve the immunity of the baby. We know that the ingredients of Uramarun are like Jeshtamadu or Yastimadu, Pippali, Shunti, Ashwagandha, Shatavari, and Brahmi, Amrata, many more such herbs which are included under this Uramarun or this Suttumaddu or Suttukara. With that reference only, we prepared this Kaumarabhritya Rasa in our institution, and it was started from 2000. This year, last year, it was 25 years of Kaumarabhritya Rasa, and we are administering this Kaumarabhritya Rasa. Initially, we prepared the tablet of Kaumarabhritya Rasa. After 2005, so for administration in infants, we made it as Kaumarabhritya Prasha or Suvarna Prashana Lehya, and that is given daily to the babies. One Kaumarabhritya Rasa contains 2 milligram of Swarna Bhasma and 5 milligram of Rajata Bhasma and 10 milligram of Pravala Bhasma, along with herbs like mainly Ashwagandha and Vacha, Ashwagandha, Vacha, and Yastimadu, Shunti, Pippali, like that 8 herbs, and the Brahmi, Mandukaparni, Tulsi, and Amrata, Gudu, which is Swarasa for Bhavana. So this tablet of Kaumarabhritya Rasa is made into Lehya. So 2 tablets is made into a Leha, and that one is given in means one baby is from birth to 3 months daily. That one is given, and 1 box is given for 15 days. That means 2 tablets of Kaumarabhritya will go to the baby along with Madhu and Grata for 15 days. 4 milligram of Swarna Bhasma and double of that Rajata Bhasma and triple of that Pravala Bhasma is going to 15 days in up to 3 months, and then we increase the dose. So that way the increasing of dose is also planned. So next slide, please. So mainly this Uramaran or Suttukara is helping in maintaining of Agni of baby. Actually, as we all know that, so Agni is impaired, that will result in Ama. If Ama is formed and means collected in infancy period itself, the infant will be repeatedly getting on, or it is getting on and off diseases, and its immunity is also going down. And when the baby is getting diseases, they will be administered with antibiotics, and once again repeated antibiotics administration is also reducing the immunity of child. That is why practice of this Suttu Madhu or Kaumarabhritya Leha is helping lot to avoid all these disorders or infections, allergies, etc., and also helping improving the immunity of the baby. And also, as it is having Ms. Kaumarabhritya, Rajata and Prabhala, they will be helping for the growth and development properly, and also to improve the intelligence of the baby also. And during the infancy period, we know that, previous slide please. So the baby will be properly, next slide please, properly developed with breastfeeding. So many mothers are not able to give breast milk to their babies because of many reasons. Maybe because of their breast abnormalities, like maybe flat nipple or inverted nipple or cracked nipple, or sometimes may not be because of these all reason, but as nowadays 1 or 2 babies and their mothers also forgotten how they took care of their kids. So mothers will be not known to give breast milk to the baby proper way. So by which the breast milk may not be produced properly in initial phase, and later also as the sucking is not done properly. As we know, darshana, sparshana, smarana, these all helps a lot in produce of or production and the ejection of breast milk. If not happens, or early initiation of breastfeeding not happens, may result in the less secretion of breast milk, or otherwise may not be secreted at all. So in such all condition, so increase of breast milk becomes the responsibility of we all, Vaidyas. So if the baby gets enough quantity and qualitative breast milk, its immunity is improved, and also we have to take care that during breastfeeding, mother's health is also very much important. If the mother does any mityahara vihara, then that will affect on the baby's health also. So we know that dushtasthanya is affecting the health of the baby. Maybe it may be vataja dushtasthanya, pittaja dushtasthanya, or kafaja dushtasthanya, and even tridosha malinasthanya and all will result in the disorders of babies. So to avoid such disorders, sthanya shodhana is also important. Sthanya vardhana is important when the breast milk is less, and if the baby is getting recurrent disorders or maybe getting on and off disorders, in such condition we have to take care that the breast milk vitiation may be the cause for the disease. That is why shodhana of a breast milk means shodhana to maybe nitya shodhana to mother will help. According to the disease of the baby, we need to treat the mother. Next slide, please. And once again, after this means up to 6 months, absolute breast milk feeding or exclusive breast milk feeding. So even in Ayurveda also we also recommend same up to 6 months only breast milk along with this Suttu Madhu or Suttu Kara or Kaumarabhritya Leha. And after 6 months, the baby requires still more nutrition. So the calcium is not sufficient, iron is not sufficient, and vitamins are not sufficient, minerals are not sufficient for the baby after 6 months. What it is means breast milk contains. So to add such nutrients to the baby along with the breast milk, it needs to be given with certain the top food or they are called as weaning food. So for that, Ayurveda suggests we need to start with the Phalaprashana, then Annaprashana. So 6th month Phalaprashana. So we all know that these fruits are rich source of minerals and vitamins. That may be the idea why the Phalaprashana is told first, then Annaprashana is told. So when we start Annaprashana, initially that needs to be with the single, means maybe ragi, like that, single grain. And then we need to, when the babies get adjusted with that, maybe 7 days or 10 days, after that we need to add the another grain, maybe ragi, then godi or wheat, and then after another 7 days or 10 days we need to add pulses. So for pulses, initially we can start with the green gram, and next time after another 10 days we can add one more pulse, maybe the chana or this groundnut or such type of these things that needs to be added every time one. So what should be the ratio of this carbohydrate and protein, or is ragi, wheat or rice, that needs to be 1 part, that needs to be 3 parts, and 1 part of a pulse. If the pulses, if the child's the digestion power is poor or Agni is poor, in such babies 4 part of carbohydrate and 1 part of pulses we need to. And while preparing this baby food, all these things needs to be, maybe the ragi or wheat or green gram and whatever we are using, pulses and all, that needs to be germinated, and then after germination that needs to be dried under shade, and then that needs to be powdered, and that needs to be, means that powder needs to be vastragalita, that way fine powder needs to be prepared. And in South Canada they prepare the what ragi halle, means that is grounded, whatever the grains and all, they are grounded and that is kept for fermentation. So then the small pellet like the ragi pellets are prepared, and then they are used. While using this baby food, means the powder or this pellet, along with that milk needs to be added, and then jaggery and ghee needs to be added to increase the digestion of the baby. And also while preparing, we need to add oma or ajwain, required quantity, and we also need to add the nutmeg and also jaikai and elaichi. So that will help to improve the taste of the food, and also that will help to improve the digestion of the baby also. Next slide, please. So up to this, we understood how we can take care of the wellness of the babies. Mainly when we discuss about the wellness, during infancy period, we need to take care a lot. So as we know that head circumference of the baby at birth, if it is 33 to 35 centimeter, around 13 centimeter increase of head circumference occurs within 1 year of a baby. That represents the development or brain growth. So maximum development and maximum brain growth occurs in first year itself after birth, and even growth also occurs maximum in first year itself. That is why our whole care needs to be given during the infancy period. That is why I covered the management of infant period under wellness. Let us observe certain management during the illness in children. So aturasya vikara prashavanam. Next slide, please. So as I already told, so prevention, promotion is very much important in pediatric age group. It is also very much important in adults, but still more important to take care of prevention and promotion. For that purpose only, early diagnosis and early intervention becomes a great tool in management of diseases in children. So let us observe mainly. So as we are our Ayurveda doctors, so people, one who come to us usually, so at the end or mainly nowadays the parents of children, one who are with the neurological disorder or developmental disabilities or developmental delays or autism, ADHD, such children's parents are visiting us as we are Ayurveda doctors more, because they are not getting much relief there in contemporary science. So they will be doing the doctor shopping. In that, they come to know that Ayurveda is one best branch where the availability of treatment for or management of such all disorders. So let us observe how the early diagnosis can be done and early intervention is done in such disorder. Next slide, please. So diagnosis and assessment. So why I took this topic here, because for early diagnosis of such all developmental delays, disorder, etc., we have one tool or a tool that is, next slide, please. Next slide, please. So that is DASI. So developmental assessment scale for Indian infants to diagnose the whatever variation which happens in infants regarding develop is we are able to understand or diagnose with this tool, that is DASI. And actually KEM Hospital of Pune, they conduct training program for this DASI, and any doctors, Ayurveda doctors or allopathy doctors, and even nutrition specialists and even physiotherapists, such all people can undergo training mainly to diagnose such developmental delays in infants. And this DASI is actually from 3 days to 30 months baby's development is assessed. So for that, as I told, every year twice this training program occurs. So usually in May, so this is last year, 26th May to 31st May, the training program was conducted. In our institution, all our teachers are underwent this training and we are certified. We can assess and give this one certificate also. We can give the children, we can diagnose their development and we can give the certificate what exactly their development is in between the 3 days to 30 months. So this can be adopted, or this training can be taken by the other doctors also, by which we are able to diagnose. Early diagnosis, it helps. And also, so if we are treating infants of that age, how much improvement we are getting, that one also we are able to show to the parents and society. Next slide, please. So for how we can do that, to show that I am presenting few cases here. One baby, one who is of 1 year, 6 months, 1.5 years, so which was brought to us, which had the history of difficulty in sitting without support. The baby was not able to sit without support, and also in spite of attainment of developmental age, means even though 1 year 6 months, the baby was not able to sit and had the history of NICU, and there was delay in milestone. It was not at all attend the sitting also. And baby was diagnosed as global developmental delay. So further means it was diagnosed as GDD at the age of 11 months, and 1 year 6 months it was brought to our institution. Next slide, please. Next slide, please. So the assessment of baby was done with the Dasi from us, and motor cluster score was 35. Actually, we have two cluster in that. One is motor cluster and another is mental cluster. And motor cluster contains 63, this one in that. And mental cluster includes around 167 different these things. Out of that, this baby had motor cluster score 35 and mental cluster it is 85. According to that, the motor age of the baby is 6.4. The age of baby is 1 year 6 months. Its motor age is 6.4 month and mental age is 7.4 month. So these are the details of that motor cluster and also mental cluster. Next slide, please. So baby underwent the treatment, Sarvanga Abhyanga, and also the Matra Basti with the Samvardhana Grata for 10 days. And 11 to 45 days, the baby was administered with the oral administration of Samvardhana Grata and Pratimarshanasya of Samvardhana Grata of 2 drops. And after 45 days, once again, baby was followed without any medicine. And after 3 months of before treatment, once again, the baby was assessed. Next slide, please. Next slide, please. So after the treatment, means after 3 months of the starting, the motor cluster, which was 35, increased to 40. And mental cluster score improved from 85 to 101. So motor age is 8.3 after the 3 months. That is 1.6, 1 year 6 months plus 3 months. That is 1 year 9 months. Motor age becomes 8.3 months and mental age becomes 10.7 months. Next slide, please. So by that you can assess the baby, diagnose the baby, and also you can assess the baby and you can show them that how much improvement the baby is getting. So that becomes objective criteria. So that is why if we are undergoing the training, that will be helping a lot for all of us. So one who did BAMS, BUMS, BHMS, they can MBBS and pediatricians, they can undergo this training program in KEM Hospital, Pune. So let us observe other disorder. So Pranava Srota Vyadhis. So childhood asthma or tamakashvasa, khasa, tundikeri, nasanaha, or kantashaluka, adenoiditis, pratishaya, etc. The different respiratory conditions we come across in children, because as Shleshma Dhatu Praya, occurrence of respiratory disorders are more in children, and Tamakashvasa, if it occurs in pediatric age group, so management is comparatively easier and also cure is possible in short duration of time compared to adults. Next slide, please. So out of these all disorder, I want to concentrate few only. Tamakashvasa. So we all know that Tamakashvasa nowadays is increasing. Bronchial asthma is increasing. Mainly in cities like Bangalore and all, increased population of vehicles. So that is increasing the chances of allergies, and chances of infection is also increasing. But still, the chances of allergy is increased a lot nowadays, and the children's exposure to such allergens also increasing. So immunity is also going down, which makes the child to become victim of tamaka shwasa. So in management of tamaka shwasa, first we need to understand which type of tamaka shwasa the child is with. Mainly whether it is vata kapha pradhana or vata pitta pradhana. According to that we need to manage. And once again in tamaka shwasa, whether it is means vega kalina chikitsa is one thing, and another is vegantara kalina chikitsa. So vega kalina chikitsa we can do it with the nebulization. For nebulization, what we can do is, so we can use different arkas for nebulization of the children, one who is suffering from tamaka shwasa, one who is with the wheeze and all. So to reduce that wheezing and easy establishment of respiration in them, we can advise nebulization. Nebulization may be done with the Barangi Arka, Tulsi Arka, and Tambula Arka, and many more arkas. In our institution, many arkas we tried for the purpose of management of tamaka shwasa and got very good result. So Tulsi Arka is giving very good result. Shati Arka is also giving very good result. And even the one more Arka. So Panasa one mainly along with the Tulsi, other 5 ingredients are there. And that Arka is also giving very good result in management of tamaka shwasa. So at present, I am also doing, actually we are also conducting clinical trial in Nishamalaka Arka. That may also give good result in management of the Vega Kalina chikitsa of tamaka shwasa. Next slide, please. Paranasa Panchaka. So the name of Arka is Paranasa Panchaka. We have the reference of Paranasa Panchaka Kashaya in management of tamaka shwasa. We tried the same in Arka form, oral administration and also nebulization, which is given very good result. So these are all the different studies which are undertaken on tamaka shwasa. You can observe here Barangi Arka is there, and this Paranayavani Arka also we tried, and maybe in future we are even trying with the Kantakari and Vasa Arka, Kantakari Arka. So lot of opportunities are there to prepare arkas and managing the tamaka shwasa. That is for Vega Kalina. And for Vegantara Kalina, we can go for Virechana, Tamaketu Virechana. If Kapha Pradhana is there, Kapha Utklesha is there, we can conduct the Sadhyo Vamana, and we can follow after this Sadhyo Vamana, we can go for Virechana. So in certain condition, if the Kapha Utklesha is not much, but the condition is Vata Kapha Pradhana, there we can conduct classical Vamana, followed by that the classical Virechana, which is giving very good result. And in very chronic condition where the Bahudosha Avastha is there and Chirakalina Vyadhi if it is there, we have to go for repeated Shodhana. So when we are doing repeated Shodhana in children, we need to take care that their Bala should be maintained. So once in 2 months Virechana we can go for, or once in 3 months we can go for Virechana in children. As in adults we can go for Masad Virechanam, Pakshad Vamanam. But in children, so we can give little more gap depending on the strength of the child, Bala of the child, and also depending on the Bahu Dosha Avastha and the Kala, Chirakalina, how much it is. So how much the chronicity of the disease is. Next slide, please. So, and in case of tonsillitis also, we are with the very good solutions. The gargling with the Tankana Jala, gargling with Spatika Jala, gargling with the Kadira Jala, those all are helping a lot. And even the Kshara Karma, application of Apamarga Kshara is also helping in tonsillitis. And Shikari Taila administration helps in reduction of size of tonsils and also the reduction of size of adenoids also. And even Apamarga Kshara Taila administration or the Nasya of Apamarga Kshara Taila is also helping in reduction of tonsils and also reduction of adenoids. So next other disorders, because the time is less, no? So we will move forward. Gastrointestinal disorder or Annavasrota Vyadis, if we consider. Udrashula is one among the common, mainly if you observe the babies, infants. So infantile colic or that is also called as evening colic is a very common problem we come across. So babies of 3 months, babies of 4 months, after 1 month of a baby, it is very common to have the ballotment and also the distension of abdomen and pain. Usually this abdominal pain is how it is expressed. It is expressed by cry of the baby. Baby is restless, not able to sleep, and it increases in evening time. So usually if we observe, that is because of the faulty feeding method. Breastfeeding is not properly done and accumulation of air inside the stomach is causing abdominal pain. So proper birthing, proper feeding to the baby and also proper latching and also proper burping helps a lot in avoiding this infantile colic. And for baby, if with these all things are also corrected, but the baby is with the colic pain, we need to observe the diet of the mother and ahara vihara of the mother, that needs to be corrected. And a simple remedy means what correction we can advise to the mother is to avoid certain pulses and all. Along with that, administration of Harita Kikanda and Drakshadi Kashaya to mother helps in relieving the pain of the baby. And for baby, so administration of certain arkas in drops, Hingu arka, Lashuna arka, and even Vacha arka is helping in reducing the pain in the baby. And even Triphala arka is also helping. The administration of Triphala arka. Once again, dosage and all according to the baby's age and weight we need to advise. And to reduce abdominal pain, so application of Vacha over the abdomen, mainly around the umbilicus, warm paste of Vacha or warm paste of Hingu is also helping. And sometimes if the gas accumulation is there, administration of stalk of betel leaf is also helping. Tambula patra, the stalk of Tambula patra is also helping. So other than that, the babies may be with the Chardi, Atisara, Agrimandya, Vibandha, Krimi, etc. And in infants, if the baby is having little vomiting or regurgitation, so there we need to counsel the mother that that is not a problem to the baby. Whenever the excess kapha is there or little dosha utklesha is there, or if the baby is taken air more, in that condition also there may be little vomiting or regurgitation. In such condition, we should not give any medicine. Proper correction of the feeding and also for proper diet of mother will help in relieving such problems. And also if the baby gets a little regurgitation, that helps the baby to means remove doshas what it is there in the baby. So that should not be controlled. So if it is more, then only we have to give treatment to the baby. We need to, we need to assess whether the dehydration is there. If dehydration is there, then we have to take care of the chardi of the baby. So then Atisara also we have to manage in that way only. If the baby is suffering with the means more stool and dehydration is there in such condition. Otherwise, the baby is one who is with the means infant, breastfeeding infant, if passes 10 times also may not be, that is Atisara. So it is because of the more movement of the intestine of the baby, little stool the baby may be passing. Mother may think it as it is a Atisara or diarrhea, or sometimes they call it as dysentery also, but it is not a, it is a physiological condition itself. So diagnosis is very much important, and certain medicines in children like Kutajarishta, Kutajaganavati, Musta Kutajarishta, Gangadhara Churna, and Jati Phala Churna or Jati Phaladivati, such medicines will be helping a lot to control the Atisara in children also. And for management of dehydration, we can plan with the arrowroot ganji, and also another is Dadima Phalatva Kashaya, which is prepared along with the jeera and jaggery. That is also helping in controlling the dehydration and also management of diarrhea. So then comes the another condition, that is next slide please. Next slide. So Vibandha. So in case of Vibandha, so nowadays the children maybe of 3-4 years also, they are fond of chocolate, they are fond of biscuits, they are fond of bakery items. These all are not having any fibers in them, and these chocolates and chocolates mainly, they are of Tikta Kashaya Pradhana and Ruksha. So that is why constipation is common, one who eats more these chocolates, and the biscuits are dry, Ruksha. So in them also chances, if they eat more, then the chances of Vibandha is more. And the children, one who eats more this bakery item, so lot of the maida, and maida is not at all having any nutrition and fiber also. So that makes the children to suffer from Vibandha or constipation. That is why such all diets needs to be avoided in their diet, one who is with the Vibandha or constipation. And proper the toilet training is also very much important when we consider the Vibandha in children or constipation in children. So in them, Triphala Arka, if it is not means with these all the corrections or proper training in the diet and toilet training, it is not get corrected, then we can give Triphala Arka. So Triphala Arka is with less dose, we are able to manage the constipation. And in certain children, we even can go with the Matra Basti. So Matra Basti, once again, if the children are with the, because complication of constipation may be the Parikartika, fissure in ano, or maybe Gudabramsha, that is prolapse of rectum, and sometimes it may be even that may lead to Arshas pile mass also. So we need to observe if the complications are already started. If Gudabramsha little bit is there, then the Matra Basti with the Kshirabala Taila is helping. And if the Parikartika is there, Matra Basti with the Jatyadi Taila. And to relieve this constipation, even Sukumaragrata oral administration and Matra Basti is also helping. Next slide, please. Haritake Kanda administration and Kumari Asava administration, Abhayarishta administration, those all things also we can plan. And even combination of Draksharishta or Abhayarishta with Triphala Arka is also helping a lot in cases of chronic constipation in children. So next comes the next condition is creamy worm infestation. Worm infestation is also very common in children, as children play more in the mainly they do lot of this what you can say, they play a lot and all, and which outdoor place may cause a worm infestation, and also with other reasons if the worm infestation. So nowadays we have that government, this one every year, twice a year, they get dewormification. Even after that, many children, they suffer from worm infestation. Even after getting this mebendazole, albendazole, within a month, they come with the complaint of the anal itching and other complaint of worm infestation in them. So we can go with the Krimihara Basti, Virechana, Krimihara Basti. Apakarshana can be done with the Kampilaka Churna. So we know that the treatment principle of Krimi is Nidana Parivarjana, Prakriti Vigata and Apakarshana. For Prakriti Vigata, we can advise Vidangarishta, Panchatikta Kashaya, Kalamega Kashaya, the drugs or medicines which are Tikta, and also the food also, it needs to be not of Madhur Rasa, or the food which means after Vipaka, which causes Madhura Vipaka, such food needs to be avoided for doing Prakriti Vigata. So medicines which can be given for Prakriti Vigata are Tikta Rasa Pradhana. Even it may be a Patola Kataka Rohini Adi Kashaya also. And such type of Kashayas or Arishtasavas will be helping. And Krimi Kutar Rasa is also helping a lot. We can advise Krimi Kutar Rasa depending on the chronicity and intensity of worm infestation. 1 BD for 1 week, 1 BD for 15 days, 1 BD for 1 month also we can give as a Shaman Aushadha. Next slide, please. So, skin diseases are also very common in children. As the Shleshma Dhatu Praya, so Dushita Kapha or Rasa Dushana. So, Rasa Pradoshaja Vikaras, Tok Vikaras are. So, chronic skin diseases may hamper the mainly psychological, it may do psychological disturbance in children. Yesterday only one child came, it was with the atopic dermatitis, and the school teachers told the parents not to send the child to school. It was atopic dermatitis only. So in cases of atopic dermatitis, that skin condition is not spreading to other. It is only increasing in that child only. So, but the teachers of school, they advise the parents to that child to stop coming school. That is how the society is also behaving with the children one who are with the different skin condition. That is why that causes a stigma in children, and chances of suicide, etc. will be more. So we need to take care. The chronic skin diseases needs to be taken care a lot. Next slide, please. So this is ahiputana, common condition in infant. The babies, one who are on the vitiated breast milk, mainly pitta vitiated breast milk, chances of getting this ahiputana or napkin rash is very common. So as I told, the cause for this ahiputana is not a local one. It is because of the vitiation of breast milk. We need to treat the mother. So vitiation of that pitta in breast milk of mother needs to be taken care. So drakshadi kashaya to mother, panchavalkala kashaya to mother, so panchavalkala kshira kashaya to mother, such all management to the mother, even haritaki kanda to mother. So that will help to reduce the pitta in breast milk. And to the baby, for local area, application of malahara, which is prepared out of daru haridra, rasakriya of daru haridra, that is rasanjana, application of rasanjana or kashaya, means malahara, which is prepared out of the daru haridra, that can be, and wash can be done with the daru haridra kashaya also, and even panchavalkala kashaya wash also helps, or sponging with the daru haridra kashaya, panchavalkala kashaya, asana kashaya, asana lepa preparation and application, those all will help a lot Here only local treatment is not sufficient. We need to give treatment to the mother also. Next slide, please. So another condition is psoriasis. Nowadays, we are observing that many children are suffering from psoriasis also. Sometimes even atopic dermatitis or the eczema. So charmadala or this vicharchika is converted into this psoriasis. Psoriasis may be Sigma kusta or Kitiba kusta or Eka kusta. So we need to observe properly which type of the condition is. In case if lakshanas are of Sigma kusta, that takes a lot of time. Means the children coming out from that condition, maybe it requires years together, 1 year, 2 years, according to the chronicity also. Here you can observe that this child is, it is little like a Sigma kusta. So whole body she had, and she underwent virechana, then once again sadyovamana, once again 3-4 times virechana, then we give her basti also. So up to now 6-7 times shodhana treatment she took, and now she is completely free from that psoriasis. Next slide, please. So Vamana we did, then we did virechana for her, then we did yoga basti, and even she was underwent jalo kavacharana, and we did takradara for her also. And wherever the thick lesions are there she was given with the application of marmani vati, and that marmani vati with the chinchaswarasa, that is boiled, and the warm paste is applied over the thick skin lesion. So with this all, so 10 months she had 6 sittings of IPD admission, that is Vamana, Virechana. So 3 times she underwent Virechana, once Vamana, and 2 times Yoga Basti. Next slide, please. So another condition is leukoderma or vitiligo or Shvitra. So once again, we need to understand which type of the condition it is, whether it is Charuna, Daruna or Kilasa. So depending on the type and also depending on the chronicity, the treatment management of this Shvitra also. So if the chronicity is more, it is Kilasa type of Shvitra, so repeated Shodhana may be required. If the chronicity is less, and if it is of Charuna Daruna, there 1 or 2 Shodhana along with the Bakuchi, internal administration of Bakuchi and external application of Bakuchi helps a lot. Maybe Shvitrahara Churna, Gajalinda Lepa, and Jyotishmati Bakuchi Lepa. So many medicines which are along with the Bakuchi, even Chitraka along with Bakuchi, those all. Along with this, Jalaukavacharana is also helping lot in reducing the cases, the lesion, means increasing the pigmentation, hyperpigmentation. So the pigmentation is improved, then the area of the hyperpigmented is getting reduced, and the black dots will be increasing, and the cover of a proper pigmented area will happen. Next slide, please. Next slide. So another is reduced IQ, and in that also we have Smriti Karanas. Smriti Karanas are made into tool, and we managed the condition. We are managing the conditions. That is also giving very good result. So Smriti Karanas, which are discussed in Charaka. So Charaka Sharirasthana. Next slide, please. So these are all the tools. Next slide, please. Next slide. These are all Smriti Karanas and Nimitta Grahanat. So these are all the 8 Smriti Karanas. You can go through, and we made the tools for the same. Next slide, please. They are used for the improvement of memory, and that can be used even for assessment of memory also. So at present, we are using this tool for improving the memory as a tool, and we are also, our future plan is to use that for the diagnosis also. Diagnosis and the assessment also. Next slide, please. So autism is also managed nicely through Ayurveda. Lot of cases of autism we are receiving at present. And next slide, please. So many more cases are there. So I think the time is already, it's 10:10. So I think maybe we will complete in another session these all other disorders of pediatrics. Next slide. Next slide. Next slide. Next slide. Next slide. So Perthes disease child is totally normal after Ayurveda treatment. Perthes is so avascular necrosis of a femur. Next slide, please. Next slide. Next slide. Next slide. Another condition, pseudoarthrosis, is also very nicely managed through Ayurveda. 8 days baby came to us, and now the baby is of 10 months. Almost the both legs are normal now. One leg was affected. So the difference at 8 months, 8 days baby, it was 4 centimeter at that period itself. Now it is half centimeter difference between the both legs. So next slide, please. So these are all how the baby is treated. Next slide, please. So in cardiac condition also, CHD also, we are helping them to come out. And also this case, what we are observing, surgery is also not possible. The baby was associated with the developmental delay. After treatment, the child was able to walk, and also you can observe that SpO2 reduced, increased from 40 to 45% to 80 to 87%. Next slide, please. Next slide. So overall, what I want to say is a child protected today becomes an adult with the treatable conditions tomorrow. So that is why we need to take care a lot during the childhood itself. So if we are managing child properly, and also we are taking care of the child, so then they become strong citizens of tomorrow. So we are able to build the nation strongly. So thank you. Anena hi samvarditante itara chikissanti. So all the other branches of Ayurveda will be supported a lot by Kaumarabhritya by taking care of the children properly and making them sadhya, and also not to make them asadhya or yapya. So thank you for the opportunity. Thanks a lot to Jayashree Madam and other all members of Tribhuvana Foundation. So, and also I am very much thankful to the all audience, one who bared up to now, even though it is 10:15, 10:20.
Thank you, Shailaja ma'am. It was so informative, and we have completely involved in your presentation that we have forgotten to take or listen who is telling somebody or asking something. So it was very, very interesting, ma'am. And you are nicely explained about how wellness and illness will be managed in the pediatric condition. And ma'am is nicely explained about that Swarna Prashana, Anna Prashana, Phala Prashana, and the disease condition. Actually, we have not touched the Arka preparations and those things, ma'am. But you have used the Arka formulations in the children, and that is really informative, ma'am. This we can really inculcate or adopt in our practice. And also various disease condition you have treated. And in your presentation, you have mentioned the research scholars who have conducted their research work in that area. It was really informative, ma'am, and it is really thought provoking. And ma'am, we are all from the different field. We are not in the we studied Kaumarabhritya in the BAMS. Afterwards, there is no touch. But today we understood, ma'am, what are all the things are there, how we can treat. Nowadays, people says that that is Bala Roga cannot be treated in Ayurveda. It is really a challenging, ma'am. By seeing your presentation, by listening your presentation, we got really confident in treating the pediatric diseases, ma'am. It was
So
wonderful,
one
ma'am.
thing I want to actually in our institution, highest OPD is from Kaumarabhritya. Highest
Oh,
number
very-
of OPD is from Kaumarabhritya. It is almost 3 times of the other department, and IPD, yeah, we are in third position. So fourth position. First is Shalya, second is Shalya Panchakarma Kayachikisa, then Kaumarabhritya.
very
So
nice, ma'am. Very
that's
nice to hear, ma'am.
acute condition means we try to manage acute conditions also, but still we have limitation that we know.
Okay, ma'am. Nice, ma'am. Nice.
Okay.
Now the session is open for the question and answer session. So we can take 1 or 2 questions because of this time constraint. So you can put your question in the chat box.
There are a few questions, ma'am. One is
Okay.
asked regarding the Urumarunnu, where you used Bakuchi as an ingredient. So, is it safe to use for long time? Is a question from one of the audience.
Actually, we don't use Bakuchi. So, for Suttumaddu, the Bakuchi is not used. So, I don't know whether the in Kerala under Uramarun, so from someone I heard that they are using. Yes.
Okay, ma'am.
So, according, I am not using Bakuchi in our Suttumaddu or our Kumarabharana also.
Yes, ma'am. Ma'am, any precautions for Shodhana in kids? Like generally, any physician will look, will be very careful doing any Shodhana in the kids. Any precautions maybe for Vamana, Virichana, Basti?
Actually, Sadhyomana we conduct even in the age of 3.5, 4 years also. So proper counseling is very much important. So when the Kapha Utkalesha is there, so if we do proper counseling, so then we are not coming across the complication, but counseling is very much important. So temper tantrum, those all things will be there with the children. And while doing Snehapana also, actually, I prefer one if the children are above 6 years, so for them, so pranayama, dhyana, omkara chanting, after that administration of Snehapana, that helps even children or adult to divert their mind and to take Snehapana. So our kids, they receive even 120, 150, 200 ml, 250 ml of Snehapana also. So it is not that difficulty, but yes, there will be little hurdles compared to adults. Many a time it is observed that so children may be cooperative compared to adults also.
Yes, ma'am. Ma'am, one follow-up question on this. Is there any age limit for Kashaya Basti to be given in infants?
Kashaya Basti, you can start from actually from 1 year itself, Charaka mentioned the dose of Kashaya Basti. So actually, we start usually after 2 years of age of children.
Thank you, ma'am. Ma'am, regarding the use of honey and Swarna Prashana, many people, many current, we get many in the social media also criticizing the use of this. What should be our answer on this, ma'am?
Actually, so why honey is there? So question is that kindles the immune system, no? So that contains pollen grain and all. So when it is having pollen grains and all, little quantity of honey we are giving, that kindles the immune system. And the combination of this madhu and grata, once again, that is even what we are giving in our institution is samapramana only, viruddhahara, no, samapramana, but in little quantity. So making it as a vokasatmya. So use of honey is making it as vokasatmya. If you observe this vaccination, there also the vaccines, what they are, there once again viruses only, no? So in little quantity is introduced to the body, so there will be immune response to the immune response from the body. So that way the use of honey is also. And actually honey, ghee and suvarna bhasma. So how that helps? This combination of honey, ghee, initially that kindles the immune system, then the repair of that is done by this honey ghee combination and also suvarna bhasma, 24 karat gold. So in absorbable form. So once again, so nanoparticle, size of nanoparticle, this all is having in between 28 to 55 nanometer size of this suvarna bhasma is required, and that needs to be in crystal form. So that is why we use Dut Papeshwar Swarna Bhasma for which is having this all quality.
Thank you for the question and answer session, ma'am. If there are any more questions, we'll take it up in the group and we can ask Madam to answer the questions. I request Madam to answer the questions in future whenever it is posted. Thank you very much, Madam.
I thank all, and also I thank my Miss from our institution teachers, one who are always supporting for this all teachers, mainly Kaumarabhritya teachers, and also my PG scholars, and also Dr. Ganavi, one who prepared slides for me, and also one who is with me now also for this presentation, and all the delegates, one who
Ma'am, can you please tell about Marmani Vati, ma'am? Marmani Vati. Yeah, can you please tell about it?
Marmani Vati. Okay. So Marmani Vati is a preparation from Kerala. I think the reference is from Sastra Yoga maybe. So mainly in the pharmacies like STP pharmacy, Anchan pharmacy, many such pharmacies, and Kerala pharmacies are also preparing this Marmani Vati. So, and Marmani Vati is having, actually I always say my postgraduates or PhD scholars, you can do PhD on this Marmani Vati. So this Marmani Vati is used in many conditions. Recently, one baby, one who had the abscess in breast and also in right shoulder. So that baby within 3 days, so totally that abscess, which was looking very, it was a big abscess. So along with the 3 days of antibiotic, so 8 days baby, not 8 days, 13 days baby get cured with this Marmani Vati application only. And Marmani Vati we apply even in cases of rheumatoid arthritis also, and the joint wherever the swelling is there. And in cases of abscess, breast abscess also this Marmani Vati, and many of the wet skin conditions, maybe eczema or maybe this charmadala, atopic dermatitis, and even in cases of the fungal infections, so ringworm infections, and actually this Marmani Vati is for Ani is that corn, so warts, corn, so many conditions. This Marmani Vati is Ramabana.
Yeah, there is one Marmagutika also, ma'am. That is different from this Marmani.
Marmagutika is also Marmani Vati only.
Okay. Thank you, ma'am.
Yeah.
Thank you, ma'am. Thank you, sir. Now I request Professor K.S. Jayashree, ma'am, President Tribhuvan Holistic Foundation, and also our most beloved ma'am, to give the presidential address. Madam.
Yeah. Thank you, Usha. I know it's already time. I'll not take much time. At the outset, I'll congratulate our Dr. Shailaja, Principal, SDM Hassan, for her enthralling session. It was an excellent one. What could need hours, you covered it in an hour. Thank you so much for that. Only few things I just wanted to say. Say, if you want to have a healthy child, the care of the child begins before he is born. So that's what she started with Garbhadana Samskara from there itself. Even prior to, if we go into eugenesis, if you are able to adapt the principles of eugenesis of Sushruta, then we can think of a very healthy progeny. And this also prevents the fetal anomalies. So fetal anomalies, they are made it compulsory that every pregnant lady should undergo for this, sonographic amniocentesis rather, for fetal anomaly. Instead of confirming anomaly and then terminating pregnancy, it's better to do a seed culture before the conception. That is what Ayurveda aims at. So we need to follow that. This is one point I just wanted to share. Another one is there are about 33.5% of malnourished children in our country. So that need to be, and we have wonderful combinations apart from the nutritional supplements. As Madam said, Matra Basti again, it's one of my favorite, method of administration. So this Matra Basti alone can give a better results in even second degree malnutrition too. This we have tried with Kushmanda Grita and also Ashwagandha Grita. And cost will be the same when you give for 7 days Matra Basti and then 1 month, whole 3 months or 1 month orally. Because dosage is less there, the cost will be the same almost. Acceptance, once the baby accepts, the course can be completed easily. Whereas daily giving children the Grita may not be that easy. Consumption may not be that easy. So next, another thing I wanted to tell you is, Suvarna Prashana, there was, Dr. Neelakanta was adding something. And now we have, if you want to go into the mainstream of health programs, how we plan to go? This is our question. So because only Sarana Bindu or Sarana Prashana, because nowadays it is being administered by a salesman, sales boy also. So this, how to check this? This is this type of challenges we have. See, polio drops, though it is available in the drugstore, people will not go and take it. There is some restriction and they maintain that cold chain or something, there is a big team behind it. So that is, such things are not there in our practice. This need to be. Why I'm stressing this point is, one of my LIC visits, they were telling it is Pushya Nakshatra we are giving for a 16-year. So we need to more standardize our approach, and more so we should make it professional than being given by every Tom, Dick and Harry. This type of practices. Otherwise, Ayurveda is brought down to home remedy level. So that should be curtailed. This is one thing I wanted to add. And as very rightly put by Dr. Shailaja, child is not a miniature of an adult. So that always we should remember whenever we treat the child. And prevention, promotion, very beautifully she explained. When the prevention comes, even in Garbhini Charya also we can take over such of the responsibilities, which could be steps, which could prevent some of the complications, which could be seen in future. And also these long-acting drugs, which can be a cause for anomaly, like this antidiarrheal drug. Even some of the Rasoshadas, if they are not prepared properly, if they are given during pregnancy, certainly they can cause some problem, systemic problem in the children. This need to be thought of, studied, and then confirmed. We need to. Then Arka is, in late 70s, in our PG department, Dravyaguna, one person, I don't remember his name, from Andhra, he made Tulasi Arka. So that was given in our children ward. After that, I had never heard of so much Arka being used. We did, of course, Ashoka Arka and Dashmala Arka, such Arkas we did in adults. But in children, using Arka is a very unique approach. Thank you very much for enlightening us with that very unique method of administration. Because Arka quantity is less, taste is not that acceptable by the child, and then the shelf value is also for a longer period. So these are a few virtues makes it much useful frequently in our practice. Then in Atisara for dehydration, prevention dehydration, you are given an easy combination, Dadima, Kashaya and Guda. And we were using Shanagapaniya, because Shanagapaniya can improve the Agni, check the Atisara, also the fluid, the quantity of fluid replacing is happening there when you are administering. And to that itself, we used to add Jaggery and little Saindra Lavana. So that is how we can make a wonderful, more effective, therapeutically effective hydrating agent in our practice. I think that should be sufficient. There are many points I have just taken after her presentation. When coming to Krimigna Dravyas, of course, none of the Krimigna Dravyas will act like mebendazole. Mebendazole anesthetizes the krimi and then it is expelled out. But that doesn't happen with our drugs. But they create an environment where the propagation of these krimis will not be taking place. So in that way, they are much more effective, and they are the effect will be long-term observable. So these are the few things I just wanted to mention. And thank you very much, Shailaja, for today's sparing. Tomorrow you have that mega event in your college, in spite of it. So that is the passion I expect from all of the youngsters. Don't try to give the reason. She could have said that she has a very mega event in her college and she'll not be able to address today. So that shows her compassion, that shows her interest, that shows her eagerness to share the experience. So this is the most important thing we should learn from people who are sky level. There is no limit for their growth. So thank you very much for listening. Namaste.
Thank you, ma'am. Today we are very fortunate to have two Gnana Deepas, and both are in a female, and both are in the same department, and enlightening us and blessed us today. And really, we are very, very fortunate, ma'am. And I wholeheartedly thank Shailaja, ma'am, for excellent presentation. And I thank K.S. Jayashree ma'am for giving me an opportunity, wonderful opportunity to host this day because Shailaja ma'am is a resource person. I'm very fortunate, ma'am. And whatever I am today is there, ma'am, that's all because of blessings and wishes of K.S. Jayashree ma'am. I'm really, really grateful to Jayashree ma'am. And I wholeheartedly thank all Tribhuvan members who are present today and who supported this program. And Neelakanta sir, I really thank you, sir, for guiding me to host this session. I'm very thankful to you. And all the renowned Ayurveda physicians who are present today, that is Dr. Anjaneya Murthy, sir, Dr. A.R.V. Murthy, sir, Dr. Anand Desai, sir, and Dr. Aruna, ma'am. And I thank all the members who presented, who has given invocation, and Gopala Krishna sir, and also the Madhavi Lata ma'am for giving a brief introduction about Shailaja ma'am. So today we'll conclude the presentation and the sessions with the Shanti mantra. Om Sarve Bhavantu Sukhinah, Sarve Bhavantu Niramayaha, Sarve Bhadrani Pashyantu, Ma Kaschit Dukkha Bhagave. Om Shanti, Shanti, Shanti. Thank you. Shubharatri. Thank you, everyone.
Sugar
Thank
and
you. Thank you.
Yes. So, Shailaja madam, thank you so much.
Okay.
But we'll have one more session, as you said.
Okay. So,
Definitely. Yeah.
thank you, madam. So,
In spite of your busy schedule, like made time to ತುಂಬಾ ಖುಷಿ ಆಯ್ತು ಅಂತ.
okay, thank you.
Thank you very
Thank
much.
you for the opportunity to all one who is involved, mainly Jayashree.
You agreed and came, that itself is great thing for us.
ಖಂಡಿತ ma'am. Thank you very much.
Alva.
Thanks to
That's
Jayashree ma'am to see Shailaja ma'am in this platform.
Yeah.
Okay. Thank you,
They are
Jayashree,
down to
for
earth
giving
people.
opportunity in this platform. So, Madam Anjaneya Murthy sir, Aruna Mangalgi Madam, ARV Murthy sir, all they were there. I was not knowing. Madam, I know, but others I was not knowing. But I
You don't get the
I
whole
got
list
blessings
now.
from all of you.
Yeah.
Thank you.
Thank you. God bless you. Take care. Love
Thank
you.
you. Thank you, ma'am.
ಆಮೇಲೆ ಗೋಪಾಲಕೃಷ್ಣ ಹೊರಟೋದ್ರ ನೀಲಕಂಠ ಯು ಲುಕ್ ಸ್ಟಿಲ್ ವೀಕ್ ಅಲ್ಲ
ಪರವಾಗಿಲ್ಲ ಮ್ಯಾಮ್ ಬೆಟರ್ ನಾವು.
ಹುಷಾರಿಲ್ವಾ?
Namaste, madam. 1 minute.
Yeah.
Dr.
Please.
Vandana, madam, if she is there. One minute.
Sure.
Just 1 minute. Dr. Vandana, madam, is here. RAV director. Hi. So she wants to say hi.
Namaste, madam. I'm Dr. Jayashree.
Yeah. How are you, madam?
I'm fine.
Yeah, great.
So you came today only, it seems, no?
Not today, yesterday night.
Sure.
Yeah. But it is first time I'm coming here. It's a beautiful campus. I must say you should visit at least once.
So madam came last year for the same
Achha.
program as guest.
Achha,
Jayashree
achha.
madam came.
Jayashree madam. Yes.
Kaumarabhritya. I had come. Yeah.
Yes.
Nice meeting you, madam.
Yeah, same here.
Yeah, thank you. Our friends are here. Dr. Nilakanta, professor from Sri.
I know. Namaskar.
And Dr. Manjula. He is a famous practitioner here. Dr. Srinivas is a practitioner. So many, I can see only the Madhavi from hospital.
Otherwise, 22 members.
Shailaja madam.
No,
Yeah.
actually there were more than 100 members.
Oh.
Yeah. 100 plus were there.
Great. Best wishes to all of you.
Across the country. See, Shailaja madam was introduced by a person from Hospet, another city in Karnataka.
Yeah, I know.
And hosting was from a professor from Chennai.
Okay.
Yeah.
Dr. Madhavi is also there. Namaskar.
Yeah. Madhavi has come. So thank you. Very nice of seeing you.
Yeah.
Thank you so much. Getting introduced to you.
Yes.
We'll not take much of your time. Thank you, madam. Sarige nan namaskara helbidi.
Thank you, ma'am. Thank you very much.
Yes.
Thanks. Anjaneya Murthy
ನಾಳೆ ಗೋಪಿನಾಥ್ ಸರ್ ಬರ್ತಾ ಇದ್ದಾರೆ ಇಲ್ಲಿಗೆ. ಗೋಪಿನಾಥ್ ಸರ್.
ಓ ಹೌದಲ್ಲ, ಹೇಗಿದ್ದಾರೆ? ಪರವಾಗಿಲ್ವಾ?
ಪರವಾಗಿಲ್ಲ, ಸ್ವಲ್ಪ ವೀಕ್ನೆಸ್ ಇದೆ.
ಹೌದು.
ನಾಳೆ ಗೆಸ್ಟ್.
ವೆರಿ ಗುಡ್. ನನ್ನ ನಮಸ್ಕಾರ ಹೇಳ್ಬಿಡಿ ಅವ್ರಿಗೊಂದ್ಸಲ, ಖುಷಿ ಬಿಡ್ತಾರೆ. ಥ್ಯಾಂಕ್ ಯು. ಒಳ್ಳೇದಾಗ್ಲಿ. ಆಲ್ ದ ವೆರಿ ಬೆಸ್ಟ್. And it will be a successful program only. Still we wish to. Okay? Thank you. Okay. ಎಲ್ಲೋದ್ರಿ ಇವ್ರು? ಮಂಜುಳಮ್ಮ
ಇಲ್ಲೇ ಕೂತಿದ್ದೀನಲ್ಲ ಮೇಡಮ್.
ಕಾಣಿಸಿ ನಿಮ್ ಮೇಲೆ ಮುಖದ ಮೇಲೆ ಕರೆಕ್ಟ್ ಆಗಿ ನಂದು ಅದೇನ್ ಮೈಕ್ ತರ ಬರುತ್ತಲ್ಲ ಸೌಂಡ್ದು, ಆ ಐಕಾನ್ ಬಂದ್ಬಿಟ್ಟಿದೆ. ಈ ಶ್ರೀನಿವಾಸ್ ಬಾಯಿಗೆ ಬಂದ್ಬಿಟ್ಟಿದೆ ಶ್ರೀನಿವಾಸ ಅಂತ.
ನಿಮ್ ಮೊಬೈಲ್ ಅಲ್ಲಿ ಏನೋ ಸೆಟ್ಟಿಂಗ್ ವ್ಯತ್ಯಾಸ ಆಗಿರ್ಬೇಕು.
ನಂದೇನೋ ಪಜೀತಿರಿ ಇದು ಇದಿಲ್ದೆ ಇದ್ರನ್ನ ಹಾಟ್ಸ್ಪಾಟ್ ಅದಕ್ಕೆ ಹಾಕಿ ಅದ್ರಲ್ಲೇನೋ ಈಥರ್ನೆಟ್ ಇಲ್ಲಂತೆ. ನಾನು ಯಾವತ್ತೂ ಟ್ರೈ ಮಾಡ್ಲಿ, ಇವತ್ತು ನೋಡಿದ್ರೆ ಅದಾಗ್ಲಿಲ್ಲ.
ಯಾಕಂದ್ರೆ ನಮ್ಮ ಮೊಬೈಲ್ ಅಲ್ಲಿ ಮಂಜುಳಾ ಮೇಡಮ್ ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಬರ್ತಾ ಇದಾರೆ.